guys, Karibu tena. Welcome back to my channel. Today I'm once again trying to get back into kind of the groove of the original purpose of this channel, which is to bring content to nursing students and nurses in order to help them do their jobs better, and kind of some tips and tricks in order to make things easier in nursing school or easier as a new nurse. So today I wanted to bring you guys a nursing assessment, which I found these videos specifically very helpful while I was in school trying to figure out how to do an assessment, what types of assessments I should be focusing on, and just a good rhythm and routine for going in and performing a head-to-toe assessment with my patients. So I hope that you like this video. I hope that you find it helpful. Please don't forget to subscribe to this channel and give this video a thumbs up because it helps the algorithm and it allows me to make more content for you guys. So it would be much appreciated. And yeah, if there's anything that I've left out on this video, please feel free to leave it in the comments below, or if you want to see something different, also leave a comment below. So before I dive too deep into things, I have a couple of preface words and things to share with you guys, a few disclaimers too, but if you really just want to see the assessment, I would skip ahead from this intro part of the video so you guys can get a good idea and see the content you came for. But I still need to preface a few things and give a few disclaimers because not everybody does their assessment the same way. Just to preface, first of all, everybody does a physical assessment differently. I've never seen two nurses do the same physical assessment. They may do very similar things in their assessment, but typically it's out of order, or they'll leave one thing in, one thing out, do an assessment differently versus the other one. So I just want to address that. You don't have to make your assessment the way that I do, but it was really hard for me in school to determine how fast, how slow, how detailed my assessment should be. So today I'm going to bring you a head-to-toe assessment and talk a little bit about a focused assessment. So there's 4 kinds of assessments that you can do. You can do it's I guess more like 3 different types of assessments that I can think of off the top of my head. You have your head-to-toe assessment, which is what I'm going to show you, kind of when you first go in to see your patient at the start of a shift. This is the assessment you want to do to cover pretty much all your bases if you can. Then there's the focused assessment, which can or cannot be an emergent assessment. So that a focused assessment is basically you choosing one body system or one area of the body to focus your assessment on. In my case, it would be cardiovascular. So I'm going to check pulses. I'm going to check capillary refill in the fingers and toes to make sure that they're perfusing. I'm going to check their chest tubes to make sure that they're not overfilling, that there's no subcutaneous air. I'm going to listen to all the heart tones, not just like, 1 or 2. So that would be a focused assessment. You may even have one for skin. So you're checking all parts of their skin to make sure that there's no breakdown, there's no skin ulcers, there's no abrasions, bruises, anything like that. And then your focus assessment can also kind of sort of be an emergent assessment. So let's say you get a trauma or you get someone with like acute appendicitis, where you're going to focus your assessment on that. It's going to be an emergent one. You're going to make sure, are you having pain in a certain quadrant? Are you having nausea, vomiting? Does it hurt when we extend your legs? Does it hurt when we press on your stomach? When was the last time you had a bowel movement? Things like that. Anything that would focus on whatever the primary problem the patient came in with is. And then the last one would be a clinic assessment, which truly is what nursing students do. They kind of learn how to do a head-to-toe assessment in a clinic fashion. So what I mean by that is it's very detailed. It's head-to-toe, very detailed. You're looking in the ears, you're looking in the mouth, you're doing the Webb and Rhines test, which is basically where you use those tuning forks to do an assessment on your patient. You're having them get up and walk and things like that. Things that we don't typically do as nurses when we very first walk in on a stable patient. So that's where it got confusing for me as a student, is am I supposed to be doing this clinic-like assessment, or am I supposed to be doing this head-to-toe assessment? Because the nurses I follow seem to do it really fast and still are very detailed. So what I want to give to you, if you are a nursing student, is learn your clinic assessment, because it is very important that you know how to assess pretty much everything in case it comes up at some time. However, figure out how you want to do your head-to-toe assessment that isn't quite so detailed, but still encompasses pretty much every body system if you can. So that's the hard thing, is they teach you clinic and then they expect you to know it when they come and comp you, check off your skill with your instructor, but then the rest of the time they don't expect something that in depth, and the nurse will probably be tapping their foot like, come on, how long does it take you to do an assessment? Half an hour? It should only take you like 2 minutes. So this is a head-to-toe assessment, not something that you would do necessarily for comping it off in your skill, getting it checked off. But it's important to know, because you need to know how to do an assessment. You need to know what areas to hit, and hopefully it will give you an idea of how to assess things when you're doing your clinic-like assessment. So that all to say makes for a little bit of a longer intro here, but I just wanted to preface with that. So I'm going to bring in my husband and show you guys how I do my head-to-toe assessment with all those disclaimers out of the way. So I hope that this is helpful. This is bringing me back to nursing school days, and when I actually had to assess Trey here in order to pass my own skills checkoff list. So this is Trey, this is my husband. He's going to be my patient so I can show you guys how I do my assessment. Are you ready?
Yeah.
All right. Always make sure you wash your hands first and apply gloves. Good morning. My name's Madison. I'm going to be your nurse today. How are you doing, Mr. Shep?
I'm doing pretty well.
Oh, good. Did you get some good sleep last night?
I did.
Okay, good. Well, I'm just going to take a listen to you and do a quick assessment just to make sure that everything sounds right and that you're doing okay.
Okay.
Does that sound all right?
Sounds great.
All right. First, I'm going to ask you a few questions. They may be silly questions that you've heard a couple of times, but it's still important that I ask you. First, can you tell me your full name and date of birth?
Trey Shup, and January 31st.
Okay. And can you tell me what type of building we're in right now?
We are in an apartment.
Yep, we are. And can you tell me what month and year it is?
It is January, and it is 2022.
Yes, that's right. And this may sound silly, but can you say the sun is shining in Cincinnati for me?
The sun is shining in Cincinnati.
Perfect. So I basically have just assessed all of Mr. Shup's orientation, and then I also assessed his speech by having him say that statement for me. Can you tell me which ear you hear my hands in?
The left.
Okay, perfect. And do you wear hearing aids at all?
No.
Okay. And I see you wear glasses. Do you wear contacts as well?
I do.
Okay. And do you wear dentures by any chance?
No.
Okay. You would also tailor those questions based off of the patient population you're working with. All right, I'm going to take a listen to you. Is it okay if I unbutton your shirt to take a listen? Okay. Depending on the stethoscope you have and how well you can hear as a student, I always suggest going underneath the gown to hear, because there's no way that I was skilled enough to hear when I first started. So don't be afraid to go underneath the gown, but always ask. So I want you to just take some deep breaths from me, okay?
Okay.
Every time you feel my stethoscope move, take a deep breath. Good job. Good job. Good job. Good job. Good job. Good job. A few more deep breaths. Good job. Okay, good. And just breathe regularly for me now. Okay. Good. Mr. Chef, when was the last time you had a bowel movement?
I do not know.
Okay. Was it yesterday?
Probably.
Okay. Does it hurt at all when I press on your belly?
No.
Okay, good. I'm going to roll up your sleeves just a little bit and feel your pulses if that's okay.
Okay.
And now this is the time you want to check both pulses at the same time in case one feels different from the other, in case there's injury to one side of the body. You want to check for regularity. And you also want to count. I only count for 15 seconds to make it shorter and then multiply by 4 and then I can get the beats per minute. So your heart rate is about at 66 beats per minute. I'm going to take your fingers back and I'm checking for capillary refill. It should be 3 seconds or less. And I'm going to have you squeeze my fingers as hard as you can. Squeeze, squeeze, squeeze. Good. Okay. Now I'm going to go lower and look at his feet. Okay, so if you have a diabetic patient especially, always check their feet because that is where you're going to find neuropathy and potentially necrosis. So always roll down their socks and check. Plus, once again, it may be hard to feel pulses, especially if somebody has swelling, and you're not going to be able to tell how much swelling they have unless you take their socks off. So don't be afraid to take off their socks. All right, I don't see any swelling of any kind. That's good. I'm going to feel both my posterior tibial pulses, which feel regular, and I'm going to feel my pedal pulses. They're also about 2+ bounding and regular. I'm going to check capillary refill. I don't see any issues with the toes at all, no necrosis. And then what I'm going to have you do is I want you to put both your feet in both hands up here, if you can, without falling back. And I want you to press down on my hands as hard as you can. Good job. And now I want you to pull up on my hands. Good job. So when I had him grip my hands and push and pull with his feet, I was testing his strength without making him get up or get out of bed. And it is strong. It's not weaker on one side compared to the other. If he gets up and ambulates, that's when I'm going to check skin, especially around the sacrum, and I can check his gait, and I can check his balance as well. But in this state, he would not be a patient that I would be concerned about that with. Okay, and then the last thing that I would assess is pain. You always want to assess pain, but not only that, you want to assess, I went off of the acronym COLD SPA, which is basically the location of the pain. I can't remember it off the top of my head, but the location, when it started, what makes it feel better, what makes it worse. You want to cover all those bases. So, are you having any pain today? And we can pretend that you have a little bit of stomach pain at this time.
Okay, yes.
Okay, when did you start having the pain?
About 3 days ago.
Okay, and what does the pain feel like? Is it sharp? Is it dull? Is it achy?
It's kind of comes and goes. It's kind of achy.
Kind of achy, okay. Does anything make it feel better or worse? Does eating make it feel better or worse?
Lying down makes it feel better.
Okay. Does maybe like laying in a fetal position help too?
A little bit.
Okay, good to know. We'll let the doctor know that that's been an issue and see if we can do anything about it. Now, if you had to rate your pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever had in your life, how would you rate it?
About a 6.
A 6. Okay. So now I've learned what his pain rating is, the quality of it is, when it comes and goes. The only thing I didn't ask is the location. Where's your pain?
In my stomach area.
Okay. Would you say it's in this area or kind of all over?
Kind of all over.
Kind of all over. Okay. So obviously if he had something like appendicitis, then we would know which quadrant to check, which would be the right lower quadrant. In this case, it's probably something more like IBS. It's more generalized, maybe gets better or worse with eating. Or if it were a liver problem, it'd be like the right upper quadrant. So you want to know your quadrants to make sure that when they point the location of the pain, you know what's going on. So that is all. Thank you, Mr. Shep. Anything I can do for you?
No, that'll be it.
Okay. And there you have it. That was a very basic, general head-to-toe assessment. Obviously, you can tailor it to what works best for you. For me, it always works best to ask them the questions some of which I ask while I'm assessing to save time. And then as a student, sometimes I would get mixed up. I'm like, I don't know what to start with. I always start with listening. It's so easy to just go straight to the lungs and listen, straight to the heart and listen, straight to the belly and listen, because you always want to listen before you fill in the belly, and it keeps you from forgetting to do that. So I start with listening, and then it's kind of easy to go from top to bottom from there. But yeah, I hope that you found that helpful. I may have been missing a few things, but once again, that was just a general idea of how you can go from start to finish, head to toe. And yeah, if you guys want to see more content like that, please let me know. And if there's anything I can do, such as helping you guys know what to look for in your assessments, like lung sounds, heart tones, what they should sound like, what they shouldn't sound like, let me know and I can work on making a video on that too. Thank you all for watching, and I will say tutuanana, which means till we meet again or see you soon. Bye guys.